Good morning. This is Carmen Marshall, the Director of Consulting of Maryland Nonprofits. Welcome to our webinar equity series, COVID-19, a matter of equity. We are really excited to have all of you listening with us. All of the lines will be muted. If you have a question, please put your question in the Q&A section and type your question there. And at the end of the recording, at the end of the webinar, we will do our best to answer as many questions as possible. I want to do a little housekeeping before we jump into the conversation with our special guest this morning. Please go to marylandnonprofits.org for an enormous amount of COVID-19 resources. Maryland Nonprofits exists to strengthen organizations, its networks for greater quality of life and equity. We take equity very seriously at Maryland Nonprofits. We want all nonprofits to be well-resourced and to be effective in the missions that you set out to do. We also have some upcoming events through the month of May. Please check out our website to find out what we're doing virtually with regard to fundraising, more COVID updates, financial management, leadership, and nonprofit fundamentals. I'm also excited that this is the kickoff of COVID-19, a matter of equity. We will have additional sessions around equity. The next one is coming up May 14th. And then we have others coming up later in May and June. So please set your calendars to be with us on those days. And you can also get more information on marylandnonprofits.org. It's hard to talk about COVID-19 without talking about all of the ways that it impacts communities. Just everybody, no matter which side of the aisle you sit on or what side of the track you live on, but we want to make sure that everybody, no matter who you are, is treated fairly in this pandemic. And so it's hard to talk about COVID-19 without talking about food distribution, without talking about housing, without talking about health and economics, education and transportation, and so on. And so before I introduce our guests, I just want to thank the Maryland Nonprofits team for all the great work you're doing, and all of our nonprofit members, all of you in the sector who are down on the ground, helping to meet the needs of people around the country, and especially in the state of Maryland right now. I also want to acknowledge our board member, Kimberly Corbin, who was responsible for, Kimberly Corbin of the Greater Washington Urban League, who was responsible for connecting us with our guest, Mr. Marc Morial. And so we thank her for that. Really excited to welcome an amazing leader, Mr. Marc Morial, who is on the front lines for the community, and we want to tap his brain for just some insight and wisdom and direction. Welcome, Marc, to Maryland Nonprofits.
I'm just honored to be here. Thank you, and congratulations to the Maryland Nonprofits, and certainly thank you to all my friends at the Washington Urban League, the Baltimore Urban League, and the Urban League of Northern Virginia, who hold up the equal sign and the banner of the Urban League in your region.
Thank you. And I can't imagine that folks don't know who you are. I mean, you served as the illustrious mayor of New Orleans, the U.S. Conference of Mayors, a previous Louisiana state senator. But can you give us a couple of minutes on who Marc Morial is? And
you know, I'm a son and a dad, you know, and a husband. I, you know, proudly grew up with 5 brothers and sisters in New Orleans, Louisiana. Really a child of the 60s and the 70s, and a child of the civil rights movement, because my parents were frontline civil rights warriors. My father was a civil rights lawyer. working with AP Turo, who was a compatriot of Thurgood Marshall in the late 50s and early 60s. My mother is a retired university administrator. Okay, university administrator and a retired teacher who was on the front lines as an organizer and an activist. And so that instinct was always in my blood. I've got 3 sisters, all highly accomplished. One's a physician, one's a judge, one's a corporate executive. I've got a brother who's been an investment banker and a political activist and a community organizer. And, we grew up with this belief that we should be in the fight and doing the work, not just for ourselves, but for the best of the community. And, proudly, I have 3 children. One is grown with a career of her own. She's an executive in the telecommunications industry. And I've got a senior in high school and an 8th grader. And then a wonderful partner, life partner, Michelle Miller, who's a journalist with CBS News. So, we, in terms of, who you are, you see people's public accomplishments and you wonder, what they are. And I think, I've always believed that, and it was the way I raised, that you've got to keep your feet on the ground. Got to keep your mind well trained and your heart well tuned. And if you do those 3 things, you're going to live a successful life and a life of purpose, And that's been my motivating factor throughout my life and throughout my career, is living a life of purpose. And for those that might be interested, I have a book that will come out on May 5th next week called The Gumbo Coalition. And that book is a leadership book. It's got 10 leadership lessons, and I tell stories from throughout my life. And because of COVID, you'll have to go online to Amazon to get the book. But, I would recommend it because leadership has really been the science and the art that I've worked to practice throughout my career. I've been extremely it's been a blessing that in my entire career, I only had a quote unquote, in the traditional way, a traditional boss for only 2 years.
Wow.
That I've been, to some extent, running my own business, my own law firm, or reporting to the people as an elected official, or in this job, reporting to the people, reporting to the board that I work for. So that's been, joyous and blessing. But what goes with that is a tremendous amount of responsibility to, as they say, handle your business.
Yeah. I'm so glad that you painted that picture for us, because if you do anything great, you don't do it alone, right?
Collective. It's all a team effort. And you may be the drum major, you may be the orchestra conductor, you may be the captain of the team, but it is truly a team.
That's right.
And the Urban League that I lead today is an incredible team of people. We're in effect a secular, we're a social justice and economic justice ministry in many respects, because the collective of volunteers and staff and people we serve and community supporters, is a giant, ecosystem or family of literally, over 1 million people nationwide. And I see myself as a captain, as a conductor, as a leader of people, and as a leader of a team.
So let's just dig into with that amazing backdrop. The U.S. Census in 2018 said that there were 38.1 people living in poverty. And the data that's recently come in around Black and Brown communities regarding COVID says that Black and Brown people are infected and dying at higher rates. And that's just with the initial data. We're not getting reports from all over just yet. And so how would you speak to that, Marc?
Well, look, we know now, and let me tell you how this is a twist and how reality is really something. At the beginning
Mhm.
of COVID, I had people in my circle say, Black people are immune from COVID.
Mm.
I don't know where they got that from. We have an immunity because of melanin to COVID. I heard
Mm.
some people say that, and in many, I thought to myself, this doesn't make sense to me, and I've not heard it, but I'm listening. Then Idris Elba, early contracted COVID, and I remember seeing him. He did a video, and he basically said, Black people, wake up. Anyone can be infected with COVID.
Mhm.
Then on the time horizon, just a few weeks later, we began to hear that the rates of hospitalization were disproportionately
Mhm.
Black and brown in New York City and in some other places. But at that point, no state, not the CDC or HHS, had released any data, any racial data. They were reporting the number of cases and the number of deaths. And so we began to join with others in pounding. And I even had some people say, why are you trying to inject race
Mhm.
into this conversation? I said, I'm trying to inject truth into the conversation because we need to know demographic data writ large, not just racial data, age data, gender data. We need to also know the economic standing of the people who have contracted COVID, as well as their health profile, to understanding new, a different, an emerging, a sort of silent disease that all of a sudden people all over the globe are being infected. We needed to know the data. Then Louisiana, I believe, may have been the first state to release some data, and it demonstrated the disproportionality in Illinois and Michigan. Then it was a cascade, and now we've had about a month of a better understanding that health disparities are a factor in how COVID affects you.
Mhm.
How COVID, whether you're going to be hospitalized, you're going to be on a ventilator, because what are health disparities anyway? They are a higher propensity to have obesity, which certainly affects cardiovascular health. It affects things like diabetes. And then we have this recurring issue, and this issue has been, it's been in my family, and that's asthma. My father died of an asthma attack.
Mm.
My children, when they were young, had asthma. And so if you had asthma and then other respiratory ailments, then the ability of your body to fight it off is more limited and your needs are greater. Those conditions are related to social conditions, lack of access, medical conditions. So we have to understand.
Right.
Now, that's the health profile. The economic profile is as follows, and we have to really grasp this. Why do we have an economic situation? Because public health experts counseled us and recommended that the best way to prevent the spread would be for us to self-quarantine, social and physical distance ourselves from others, which meant businesses, schools, non-essential government agencies began closing down. The economic challenges we face are as a result of what I call a self-induced economic coma, which was necessitous, which was essential, which we had to do in order to try to stop the spread and flatten the curve of COVID. So now African Americans and the situation for African Americans, the data is going to slowly come out about the Latino community as well, the Latinx community as well, because their numbers are showing disproportionality. Some of our allies in the Native American, American Indian community have indicated to us that there's a huge problem in Indian communities across the nation because their health infrastructure is so inadequate. So the idea is we can't have a discussion that's not grounded in truth and in fact and in data. And I say, shut anybody down. We're not injecting race. We're injecting truth and facts into this conversation. And very, very, very importantly, we have to discuss, okay, that being the case, what does it say and what does it mean? These health disparities have been around. National Urban League State of Black America report every year for the last 20 years. Health disparities, health disparities, health disparities. Obama sought to put a dent in the access element of health disparities and passing the Affordable Care Act and the expansion of Medicaid. And then you still have a couple of governors states whose head may be as hard as a rock, who've refused to expand Medicaid solely because of political purposes. So I'm calling on them now, the governors of places like Texas, Mississippi, Alabama, Georgia, expand Medicaid. Put your people first. Large Black and Latino populations in Texas, significant Black population in Mississippi and Alabama and Georgia. In my home state of Louisiana, Governor John Bel Edwards 4 years ago gets elected, says, I'm going to expand Medicaid. Within 6 months, nearly 400,000 people had health insurance who didn't have it previously. So this is we're talking about steps that can be taken, that should be taken. And every mayor, every governor, every community should have health disparities central to their discussion about COVID.
So what would you say, Marc, to those in the community, the average citizen in the community about what they ought to be thinking about, what they ought to be doing? How do they take responsibility for getting the facts? What would you say to them?
So I think people now, ladies and gentlemen, brothers and sisters, friends, follow the social distancing guidelines until they're eased. Don't be a fool. Don't go out. Don't think you're Superman or Superwoman and you can't get infected. Or in this instance, because we don't have universal availability of testing and the disease is asymptomatic, you could have it and not know it. Follow the guidelines. As tough as it is, look, I'm 7 weeks, working from home, 7 weeks in my home. It's difficult. It's tough. I mean, I'm not complaining because, of course, my situation is not the average working American situation. It's tough, particularly if you may be in a house with 5 or 6 people, you're sharing a house, you're doubling up. It is difficult. Follow those dictates. Take care of your own health. We have to introduce in communities the concept of self-care. How do I care for my own health? How do I take responsibility for what I can do? I've got to have access to a physician, but I've got to do the best I can to impact my own health and the health of my children and the health of members of my family. And that requires us to be educated. That requires us to consider in a very different way what we eat, how we eat, where we eat, how we can get mobility and exercise built into our lives. Access issues are critical. If we have access to a doctor, take advantage of it. Get an annual physical. You feel a pain, go to the doctor. Don't delay, don't wait, don't ignore. We have to engage in self-care, which to me is self-love. Mm-hmm. And that's a component, while all of the public policy issues, all of the social determinant issues we have to work on. But this is not a magic bullet. There's no pill we can take. There's no shot in our arm. There's no magical piece of legislation that anyone can pass. This is going to take a tremendous amount of work because its roots are in the country's legacy of racial justice, which began with slavery, continued with segregation, and in the North with the de facto segregation of residentially separating African Americans, which is the legacy of this country, and it's only since 1954 with Brown v. Board, in 1964 with the Civil Rights Act, and 65 with the War on Poverty that we began. And in that continuum, there's been tremendous pushback. Look, the effort to repeal the Affordable Care Act, which was a modest step, lawsuits, campaigns, it was saved by one vote in the U.S. Senate because of the courage of John McCain. You're dealing with still things that make good sense. There's still a tremendous amount of pushback, but we have to be advocates for the policy shifts and changes that are needed, and we have to be advocates of the doctrine of self-care.
So
we have to love ourselves. We have to take care of ourselves to the best of our own abilities.
So I hear you saying that it's not a magic bullet, that there's an individual part each individual has to play. And then there's what happens on the policy side. So what would you say to leaders in the community about how to begin to have those conversations? Because when you talk about racism, people get quiet. Folks get agitated. When you connect it to what I call our shared history, right? Especially here in America, folks get nervous and it gets under people's skin. So how do we?
It does. Race is a difficult issue for people to deal with. It remains a difficult issue for people to deal with. But I think we have to be proactive in promoting the solutions. Many of the solutions that we champion do not just benefit African Americans. When you expand Medicaid, and one of the hidden populations, in the United States are poor white Americans. Mm-hmm. The white Americans, the 8 to 9% of white Americans who are in poverty, the white Americans who are working class and living like many African Americans from check to check. Mm-hmm. There's a lot more. If you look at the objective alignment, now we have the factor of race that they may not have. When you look at economic conditions in many places, there are wealth differentials, but the working class and poor white American is never really in the conversation in the way that it should be, that there's joint, if you will. So if you fix the healthcare system and you focus on closing health disparities, I guarantee you that it will benefit poor white Americans as well as African Americans, as well as Latinos. I guarantee that's the case, and most experts will tell you if you improve access in rural areas in the South where you have large populations of Black people, but you have large populations of white Americans, there is going to be a benefit. If you push for a broader set of conditions within schools, what can you do in a school? I mean, you have to ensure that that there are extracurricular programs and activities that integrate mobility into the children's curriculum and work. There are many little things and the big giant things that we can do, but we also, I introduced the concept of children because we have to focus on our children. Mm-hmm. Childhood obesity is at unacceptable levels in this nation. We have to this is all about self-care, it's about self-love, and it's about public policy interventions that are necessary. When the Affordable Care Act, called by many Obamacare, passed in 2010, 2 years later, well, after it was implemented in 2013, when we looked at our index, our racial disparities index, our equality index in 2015, we saw that the health index had narrowed. slightly. And it's the first change we had seen in quite a long time. So you can make a difference. Public policy interventions, but what public policy interventions require is courage. Look at how quickly members of Congress ran to create a $500 billion, half a trillion, $500 billion lending facility for airlines and hotels. Now, I'm not saying that many people employed, that's not something that needs to be done, but it became the first thing. Not expanding unemployment benefits, not getting checks in the hands of people. And so there was a guy on the radio in Washington, D.C. You may remember him. Are you from Washington, D.C.?
No, but I've been around D.C. a minute.
Remember a guy named Petey Green?
Oh, wow, yes.
So
Yeah, he was
Petey Green
ahead of me, but yes.
Petey Green, I remember when I was young, I was in
WL.
law school. He was on the radio. He used to say, you got to get your priorities straight.
That's right.
It's all about your priorities, right? What are your priorities?
Mm-hmm.
And the debate we're going to have now is, what are our priorities? Do we allow health disparities to be exposed, and we put Humpty Dumpty back together again in the same old way?
Mm-hmm.
Or do we look and say, look, if you're going to invest in a Marshall Plan for public health in America, let's put racial disparities at the front. Let's put racial disparities in the conversation so that we fix the public health system, but we do it in a better way.
So stay right there for a minute. So when you say things like put racial disparities in the front, you know what kind of pushback you could possibly get from just even making a statement like that, right? But I heard you also say that when we do that, it not only helps Black and brown people, it helps everybody.
Yeah,
right?
and look, you have to withstand some of the criticism.
Yeah.
You have to have enough courage to discuss the point. And here's what I tell people today. So right now, the country's changing demographically at an accelerating rate. That demographic shift means that today, probably maybe 45 to 50% of workers between the age of 25 and 50, 45 or 50, are from communities of color.
Mm.
Communities of color are going to be the drivers of the American economy moving into the middle of the 21st century.
Now, why do you say that?
It's because of the demographic shift. If you're talking about half the workforce being white, half the workforce being non-white, you don't have to be a mathematical genius to understand how influential that half is. Both halves are. So it's not, in the 1960s, Black Americans were 10 to 12% of the population. We're now 12, maybe to 14% of the population. But if you amalgamate other communities of color may be in the census of 2020, 30% of the population. You can't ignore, it's not an isolated small group. That's why I don't really like the term, nor do I use the term minorities. I don't use the term minorities. I think we're talking about communities of color. I think we're talking about people of color. We're talking about African Americans, and even the African American community in the United States is evolving. We have Afro-Caribbean, we have African immigrants who are part of the community. We have blended families. It's not the same as it was, 50 years ago. Our communities are evolving, and America is indeed evolving. And public policy leaders, you can't curse the wind. You can't curse the sun.
Mm-hmm.
You can't curse the moon and curse the stars and say, well, if I curse the sun will never go away. If I curse the moon, it'll disappear. If I curse the winds and the thunder, it'll go away. You can curse the racial disparities. People can say, I don't want to talk about it, but all that is ignoring the truth. And so we have to build a broader consensus that everybody's interest, is going to be positively impacted if we confront racial disparities in health, in economics, and in education in this country. I tell you a very, very story about racial disparities. It's really a story about where my grandmother grew up. where my grandmother lived when I was a little boy. So she lived in a neighborhood and in New Orleans called the 7th Ward. So New Orleans neighborhoods, they were sort of like little patches. So it would be like a cluster of 5 or 6 blocks where Black people lived. And then you go across one street, and then the next 5 or 6 blocks was predominantly white. Mm-hmm. And I always see that the streets would be like old dirt type streets all the way up to the dividing line. And then when you went across the dividing line, all the streets in the white neighborhood were paved, when it was essentially the same neighborhood and the people lived in the same kind of houses. I used to say this, and then you go and you see that there was a playground over here, and there were swing sets and a lot of nice stuff. And the playground over here in the Black neighborhood, everything was broken down. Mm-hmm. And I said, that's disparities, right? Same community, same city, same neighborhood, divided, streets paved over here. So in New Orleans, up until probably the 70s and the 80s, the streets in white neighborhoods were paved. The streets in Black neighborhood were just not generally paved. Those were policy decisions being made by the official city fathers of those generations of 60 to 70 years in terms of how they built the city. And that's an example of disparities. And so we see it now and we say, well, why is this the case? How come it's like that? Well, it was like that because it was ordained, it was directed to be that way. So, for example, in Georgia, I understand that in some rural counties in Georgia, there are no hospitals, that people have to go hours or an hour and a half to get to a hospital. Why is it that way? Because Georgia didn't put county hospitals in these poorer counties. That's an official decision being made that leads to disparate treatment for people. So in many respects, people have to be educated about the nature of disparities to understand that fundamentally what you're talking about is, let's have a future of fairness. Let's have a future where we work to level the playing field. But to level the playing field is going to take some extraordinary effort, special investments and work.
So because when we're talking about equity, that's what we're talking about, right? Fairness. Let's take a question. Let's see. Angelique, you want to go ahead and read our question?
Sure, we have a question. How will Black COVID-19 deaths affect our census count and thus our voting power in the future?
Well, obviously, if someone was counted before death, the form was sent in, that they're counted as a person. But obviously, with 56,000 people who've died, almost 60,000 people who've died, maybe half of them are people of color. I'm not sure, on a nationwide basis. Those people will not be counted. And it can have an effect, and probably to a greater extent in areas, cities like Chicago and New Orleans and others that have large Black populations. But now that you mention the census, I want to make a shout, make an appeal, encourage people to fill that census form out, go online, or there should be a census form being dropped off or being delivered to your house by the mailman probably in the last few weeks. We've got to be counted. The response rates today are lower than they were 10 years ago. We've got to get those response rates up.
Angelique, do we have another question?
Thank you. We have a question from Ms. McNamara. I appreciate Mr. Morial's observations and analysis of the health disparities of Black and Brown people. I'm affiliated with a community center that assists people with food insecurities, and we are looking to expand our services to teach healthy cooking and an understanding of nutritious foods, moving away from consuming processed foods. One problem we run into is how to motivate people to change their behavior. Do you have any suggestions for engaging adults so that these new behaviors will filter down to children in the family?
I'm gonna use, I think it's like green eggs and ham. You know, until you try it, you don't know. And look, we've engaged in healthy food preparation here at our home. We prepare gumbo. We don't put any seafood, any shellfish in the gumbo. We're very careful about. And one thing I've learned is I had an experience recently where I served my children for breakfast. We served them some plant-based meat, plant-based sausage. They ate it. They didn't say anything. I said, don't say nothing. Just put it on the plate. They ate it. And about an hour later, my son, who's a little older, said, Dad, was that real? I said, man, it ain't real. It's going to be. Weren't they good? He said, yeah, pretty good. So, I mean,
Sounds like you broke the gumbo rule, Marc.
some of this stuff is mental, right? I mean, obviously, it's a little at a time. But look, I don't want people to have what I call dietary wake-up calls. What's a dietary wake-up call? You change your diet after you have a health scare. You have some sort of heart condition. You have some sort of cardiovascular condition. And then all of a sudden you wake up and say, oh, my survival is necessary for this. Yeah, you can enjoy some of the foods we like cooked differently and get the same taste. I can testify to that. And look, I go light. I love Popeye's chicken.
Okay,
right?
so listen.
But I treat it as a delicacy.
So let's talk about that. Let's talk about the temptation of that our communities are just laden with fast food, just laden with it. I mean, you can't go a block or two without. I mean, isn't there some responsibility?
Let me tell you what you'll see communities do in some parts of the country. They zone out fast foods.
What do you mean?
They don't allow them in, they don't want to allow a fast food establishment in particular neighborhoods.
Okay.
What it's done in some communities is it's protected family-owned diners, small family-owned food places that can't compete with the fast food place, but if the fast food establishment is not nearby, they can indeed survive. And I think local elected officials control zoning. City council members and mayors control zoning. You can limit the number of fast food, pawn shops, liquor stores in our communities. That's not a decision made in Washington, D.C. That's a decision made at the local level.
So, Marc, what do the citizens need to do?
Citizens need to be active and they need to make a demand. Mm-hmm. I think they need to say, we want to limit check cashers. We want to limit liquor stores. We want to limit fast food. Notice I didn't say eliminate, limit, greatly limit the numbers in our communities. But I like what the caller, or rather the questioner, mentioned, and that is teaching classes, helping people understand. It's got to start very young. It's got to be, there's a program I'm familiar with where they'll even send a coach with you to the grocery store to show you how to buy the food that you need to buy, right? And, some things are simple, like using olive oil as opposed to using, it's probably a little bit more expensive. That's the problem, right? Than using traditional canola or vegetable palm oil mixtures, which is what you get mostly on the shelf in stores. Many things limit fried food, limit it. And sometimes you can make progress. You don't have to cut things out, just limit it. So I'm only going to do it once a week or twice a month. It's not going to be the way I prepare things, and learning how to bake and steam and do things. I figured out how to cook a lot of stuff in the microwave. I ain't lying.
I want to remind our listeners that you can put a question in the Q&A, and I think we have a few more questions. Let's hear them, Angeliki.
In what areas of competency should nonprofit organizations be bulking up in to be part of the solution regarding COVID-19?
The most important area of competencies for nonprofits is financial management and fundraising, right? Because the lifeblood is resource. I think that that's a really, really important foundation for most nonprofits. You've got to be able to raise money, whether it's through philanthropic grants, government grants, or through donors. And then you've got to effectively manage it. I've seen more nonprofits fail because of financial management, not getting an audit, not balancing their books, intermingling funds where it is inappropriate, missing filing deadlines for reports, just basic stuff, basic stuff. And a good nonprofit that does good work and beloved is all of a sudden in a very, very difficult and tough shape. That's number one. Number two, I think knowing what a community needs. And I think the nonprofit world, all of you who are in the nonprofit world are out there on the front lines working and fighting every day, and your work is never done. There's always another family, another individual that needs to be served. There's another issue or community crisis that you have to indeed respond to. I think one of the most important things we can do in a nonprofit space is find collaborations. Even when we seem to be competing with each other for money, we need to find collaborations. At the national level, there are about 10 to 12 civil rights focused nonprofit organizations, the National Urban League and the NAACP and the National Action Network, and just to name a few and others. We work together primarily on issues of public policy. And most of our meetings with, whether it's a Charles Schumer or Nancy Pelosi in the Obama days with Obama, sometimes with corporate executives and other activists and leaders, we do it collectively. We try to build collective agendas. This work takes place behind the scenes. It's not really on blast. It's not out front because effectiveness does not require it to be out front. So very importantly, I think there are a lot of areas, but I'm going to put a focus on financial management and fundraising and increasing. Those things are, fundraising is an art and a science. Financial management is primarily a science with a little bit of art in it. But you've got to, that's fundamental whether you're managing a $150,000 budget or a $25 million budget. Those elements, and it's a little more complex the bigger you get, but it's still fundamental.
It's fundamental, yeah. And we've spent 25 years doing just that, teaching nonprofits how to incorporate best practices for sound fiscal management. Absolutely.
Crucial.
Yeah. You mentioned something earlier about folks needing to take individual responsibilities about how they eat. I just want to step back for a second. How do we balance the inequities between, you need to do what you need to do to improve your individual health, but then how do we address the systemic changes that are needed?
And some of the eating issues are systemic because they go to what's being offered in the grocery stores in our neighborhoods. What kind of eating establishments are in our neighborhood, whether it's predominantly fast food or whether there are other offerings and other opportunities. So some element of that is systemic. And I prefer the word self-care versus the word individual responsibility, because that word's been charged up by what I'll call right-wing interest in this country. Self-care means I got to love myself. Okay, be there shortly, son. Yeah, you go first. Okay. And I think that the systemic issues, so I think where we have tremendous influence politically is at the city level. We have African-American mayors, African-American council members. We have at that basic level, every city today after COVID should have a health equity task force or commission. And that task force should be charged with building some recommendations. That task force ought to bring the best minds and the interests of the community together, a combination of both experts and community leaders, and work at that level. At the state level, it needs to happen. So what can you do at the city level to confront health inequities, right? What can you do at the county level to do it? What can you do at the state level? We can't just sit and wait for the magic policy to fall from the heavens of Washington, D.C. It won't happen. Although there's a role we have to play, but we got to build this down at the local level.
So even with the nonprofits, how important is it for nonprofits to incorporate an equity lens in the work that they do? And
Essential. Today, essential. I mean, you can't do your work today without incorporating an equity lens, without understanding that we have to talk about structural change. We have to talk about structural reform. We have to pursue structural change and structural reform in our school systems, in our public health systems. This is exposing how can the United States of America have to go to China for masks, China for ventilators, China for gowns, and we don't manufacture hardly any of it here in the United States. China for vaccines, China for medicines. That situation has to be reversed. It's unacceptable. Why can't we make masks and gowns in Baltimore? Why can't we make masks and gowns in Philadelphia?
so if you were going to, encourage nonprofits to drive equity, how would you say they need to go about it?
So I think everyone should be introspective. So I would say, there are many ways to do it. First, on an individual basis. The first thing a leader, a CEO of a nonprofit board has to do, we have to educate ourselves on what the concept of equity means. Number two, we need to know in our own community, what are the disparities? What's the disparity in the high school graduation rate? What's the disparity in the lifespan in your city? What's the disparity in the unemployment rate, the median income, the home ownership rate? You got to know the picture in your own community before you can attack it. Get the data. And then identify where on that continuum can your nonprofit make a difference. Is it on health equity? Is it on economic equity? Is it on equity issues with respect to schools? No one has the bandwidth to confront it all, right? But it requires a new conversation. It starts with that, and it says we have to make structural shifts and structural changes. So in the economic space, one of the things we have got to do, we have got to get wage rates up.
Mm-hmm.
We have to have a national minimum wage. It's just not acceptable for people to work and earn money and be responsible, and that little check comes in, and that check doesn't go far enough for them to just basically survive.
Mm-hmm.
Basically survive. So they need a Section 8 certificate, they need food stamps, they need whatever else they can get, because the money that they earn is not enough. That's a basic fundamental of the economy, that if you work and earn money, you'll be able to take care of yourself. I mean, that goes back.
Inequity, right? That's a picture of inequity.
That's a picture of inequity. And then I talk some of my, policy making friends. The way they want to fix the problem is by creating more social services programs, which I say, okay, we need addition, but we got to deal with the fundamental.
Mm-hmm.
The fundamental is you work and you don't earn enough money, and you need a job, and you need so is that the society where work is just, we have to think about new ideas. There's been talk about guaranteed basic income. I've not embraced that as an idea I'm ready to endorse, but I certainly have embraced it as an idea I want to take a look at.
Mm-hmm.
And think about how would it work? Would it be better than what we have now? Is it the best alternative? We have to think about those things, because in the decade, in the century, the 21st century, why is it that poverty rates seem to be increasing when the economy seems to be growing? Why is it that poverty rates seen and or what I call economic insecurity levels continue to increase, even though the economy grows, the stock market grows up, the wealth of many increases dramatically, yet for 70 to 80% of Americans, they're just rocking along. And in real terms, they're not better off than they were 20 years ago from a family perspective. We have to look at those issues with clear eyes, a sense of data, and just understand where we are. And
so Marc, I want to try to get through a few of these last questions and rapid fire before we wrap up. And we really appreciate this focus, how you're helping us to focus. So I want to ask Anjaniki, take us through the questions and let's see how many we can get in before Marc needs to get out of here.
Yes, I'm just going to try to take them in the order they were received. Some people have been waiting a while. Can you speak to the reports that some people of color are worried about wearing homemade improvised masks in public for fear of being thought of as a criminal?
I would not wear a bandana. And I've been on record saying I would not wear a bandana. It invites racial profiling, right? And I'm using a bandana specifically because in some communities, a bandana is part of the uniform for gangs. It is, so it invites profile. So I've recommended against, and I would forcefully recommend against wearing a bandana, right? And something other than a bandana, type of or looking thing. I mean, I was online last night and I actually bought some masks and they had the logo of my favorite football team, the New Orleans Saints, on it, right? I think they were 3 for $5 of some sort, right? So there are many other things that you can pull together, but I would not invite racial profile. But I would also say to cities and police departments that they should promulgate guidelines and educate their members of their forces to be extremely diligent and careful not to profile people in this COVID crisis. But the better thing is don't wear a bandana.
Thank you. Is there an example of a jurisdiction that has been extremely effective in communicating COVID safety steps to communities of color, implementing contact tracing systems, or something that's been well received in that respect, or implementing quarantine, isolation approaches that compassionately engage with infected persons so that they can heal and keep their families safe?
That's a very difficult question for me to respond to because I don't have the perspective. I've been in my home. I get an opportunity to watch the national press and pay attention to the New York, the media here in the New York region, monitor some news articles because our staff compiles them each day. I couldn't answer that, I think, effectively. I do believe that Governor Andrew Cuomo of New York has done a great job from the beginning, and many others have followed suit by conducting these daily briefings. If you've seen them, where he goes logically through all of the steps that are being taken and works to educate the public on why the steps are being taken based on the data. So, I think in New York is a complex place because it's big, and New York City is a place where 8 million to 9 million people live closely together. The state's got, 20 million people or so. It's a difficult place because it's crowded in New York City to maintain social distancing. But I would hold him up as an example. I think that the mayor of San Francisco, I don't get an opportunity to see her, but I do note that she, London Breed is her name, very early on, in effect, shut the San Francisco region down and imposed broad social distancing or physical distancing on people. So I wouldn't, that's a question I may be better able to answer sometime in the future when we see more reports and we see more information. But it's a good question and an extremely valid question. I think the most important thing for people to do is look at those CDC guidelines that give the best sort of direction on what we all ought to be thinking about. You know, it's the best thing out there right now.
And Janika, can we get through a couple more before we say goodbye?
Yep, got about 2
Sure.
more minutes.
As part of a team of leaders that are at the table negotiating change, what can you share with us about what may be coming down the path?
I think what's going to be coming down is support for cities and states. I think that there's also going to be a concerted effort to inject resources into the public health system across the land to help rebuild the public health system. The last bill, I think there's going to be an effort to ensure that when vaccines are available, that they are broadly available, and that the inability to pay, you know, I think there are those of us who think that they should be free, and there are those who say, well, let's make it free for those who don't have insurance. That's going to be a discussion and a debate. And then I think there's going to be a conversation about workforce, jobs. How do you help people sustain themselves, and how do you inject energy back into the economy? We're going to be focusing to ensure that Black small businesses owned by people of color, women, are not left out of the conversation, not sidelined, and to some extent, because I'm not pleased at all with how the first round of the PPP, Paycheck Protection Program, was administered. Too many businesses, 2/3 of the money went to people, you know, who were publicly traded companies and larger concerns. I don't think that was the idea of the program. So we're pushing hard. I'm going to say that I'd like all of you to call your member of Congress and leave a message and say, in COVID, put people first. Put people first, and don't forget equity. That's easy to say. You can call 202-224-3121. 202-224-3121. That's the main number of the Capitol. Ask for your member of Congress. Leave a message. In COVID, put people first, and don't forget equity.
Thank you, Marc. One last word about the future, and then we'll let you go.
Thank you.
The
future?
Yeah.
We have to remain strong and hopeful. This is our Great Depression in World War II. This is a challenge unlike any other that we faced as a generation. We've got 30 million people unemployed, 56 to 60,000 people, more than we lost in the entire Vietnam War, have died because of COVID. This pandemic has been wicked. It's been nasty. We're going to have a challenge to renew and rebuild. And I want us to hello?
Yeah,
every time a call comes in, it clicks out, you know.
Go ahead.
Yeah, so I want to make sure equity and fairness are at the front and not relegated to the rear. And I think it's going to take the voices of people. That's why I really want to encourage people, whether your congressperson is a Republican or a Democrat or whatever they are, call them up and say, put people first. Put people first. And don't forget equity.
Thank you so much, Marc.
Last thing, follow us at Nat Urban League. You can follow me at Marc Morial on Twitter. And you can join me Tuesdays and Thursdays at 10 a.m. for our Facebook Live. Let me give that phone number out again.
Yeah.
Okay, 202-224-3121. It's the number at the U.S. Capitol. 202-224-3121.
And we also want folks to know that if they need help with their equity work at a nonprofit, Maryland Nonprofits does equity and inclusion consulting, and we're able to help you build a strong program at your organization. We want to take this time to thank Marc Morial, the President and CEO of National Urban League, for your great insight, wisdom, direction. Thank you for spending this hour with us.
Hey, I appreciate being with you. Hopefully we'll do this again.
Yes, look forward to it.
All right. God bless you. Thanks to my friends at the Washington Urban League, the Baltimore Urban League, and the Urban League of Northern Virginia, lifting them up.
Thank you, Marc. We want folks to know that no matter what side of the aisle you're on, we want you to be safe and take care of yourself. Thank you for being with us. Stay tuned. Maryland Nonprofits will have other, the next equity series on May 14th. Check out our website for more information. Bye.